I'm here to talk about medication and talking also about an application that myself and Declan Brennan have designed in order to support nurses in the clinical area, and I'll talk about it later. So the administration of medication to patients is a significant role of a nurse and the nurse's role, and nurses frequently experience many interruptions or distractions while administrating medications, and this may lead to medication errors. So what's the cause of poor medication management? There could be, as mentioned, the interruptions and distractions as the nurse is giving out her tablets or his tablets, that people come up and ask questions that distract the nurse from her task. Another issue is the nurse's heavy workload, where the turnover of patients is very high and the demands of workload is extremely high. There is insufficient educational support for the nurse, and then there's poor competence in calculations, which is another issue. So for the advancement of nurses to be proficient and accurate in the clinical area, it is essential that the nurse increases her knowledge and education and training necessary to perform this task in order to reduce the risks of incidents. So the medication error falls into two areas. There is failure to adhere to the acceptable standard of practice in relation to medication management, and the second is a failure of the part of the nurse to accept that he or she has a problem with medication. The medication error affects up to 3 to 5% of hospitalized patients, and this in turn reflects on the patient. The patient has to stay longer in hospital to recover. It may result in disabilities, and it may develop into deaths. This is where, as far as now, I'm going to talk about the application that myself and Declan have designed. And basically it's drug calculations, and it works on the mobile. And the beauty of it is that if you put it on flight mode, it is unlikely to interfere with any of the working equipment in the clinical area. So the application at the moment is being offered free, and without further ado, let's go to the demonstration. So let's go through one of the calculations, which is the volume of liquid. So here we have, as far as the table here on the app, and I'm going to use as an example, I'm going to use Oromorph. So the doctor prescribed 7.5 milligrams. So you just click on into the box and I key in 7.5. Okay, and then we scroll down and we have the stock strength, which the stock strength is 10 milligrams. So we just key in 10 milligrams. And then the volume in the amp, which is, for this example, is 5, let's suppose. And we ask to calculate. And there we have the 4 mLs. So we have the dose prescribed, 7.5 as an example. We have the stock strength, which is what you have, and then the volume in the ampule, which is, at this case, it's 5 mLs, and you calculate. Okay, so let's go through another example. Suppose if you're on the ward and you want to give tablets, an example, maybe digoxin. So the doctor prescribes, and let's suppose describes 62.5, and this is micrograms. So we key in 62.5, and here we are in micrograms. Now we have the option, as you can see, milligrams, grams and kilograms. So we're going to stick to 62.5, and that is the doctor prescription of micrograms. So the dosage in the tablet, which is the 0.25, so we just key in 0.25 and we ask the app to calculate, and there we have a quarter of a tablet. So that's some of the examples. Now, as you can see, we have the IV drop rate. I've explained the number of tablets. The rate minder, it calculates that as well. Fluid maintenance, and also the dosage drugs related to body weight. So this is an example here, and then once we calculate that, then we can calculate the volume. So that is the drug calculations.